It is estimated that of our nation's healthcare costs, $3.5 trillion go towards treating people with chronic healthcare conditions. At the present time, more than an estimated 12 million people are living with a serious illness or chronic disease. It has been said that these costs will only get worse as the baby boomers age and require more healthcare treatment. People who are living with these diseases are heavy users of the healthcare system because of needs, wants, and symptoms that are not resolved. This is when we need to advocate for our families that palliative care needs to be involved to discuss our goals. Education needs to be provided about palliative care so that it is a known resource. As I continue to work at the bedside, patients continue to be sicker and sicker. I am a huge advocate for palliative care and the work they are able to complete. Today, you will understand why palliative care conversations are important and that there is no better way to educate our population. So, you might ask why I'm so passionate about this matter. First, people are dying and families are suffering because of the lack of intervention. Palliative care addresses needs from patients and families over time, no matter what stage or treatment plan has been put in place. According to the CAPC, which stands for the Center of Advanced Palliative Care, America's healthcare delivery system does not currently meet the needs of patients and families living with a serious illness. There is a lack of advocacy from nurses and doctors to patients and patients' families to have these crucial conversations, even though they are taxing. Palliative care is intended to prevent and relieve suffering. However, studies also show that patients who receive concurrent palliative care tend to live at least as long as those whose care is directed at disease management alone, per the barriers to access palliative care. Next, how do we tackle this lack of intervention? Education needs to be provided so that people are aware of palliative care and what it's all about. We need to educate people that sometimes the quality of life is much better than the quantity. I read an article from the Huffington Post, which was a story that someone had shared about their mother's diagnosis of stage 4 breast cancer. And she said that we are so focused on the disease that we forgot to focus on the person. Indeed, education should address the misunderstandings of patients and families of people who are diagnosed with cancer or are actively dying are only candidates for this type of intervention or conversation. Palliative care is an approach to care that you may want to access at any stage of a serious illness. It helps you manage symptoms and address concerns that matter most to you, as stated by the Mayo Clinic. Palliative care can address needs of patients by avoiding the ER, 911 calls, and focusing on the comfort of a person and supportive measures. By doing this, we can reduce the cost of health care throughout the system. Clearly, education is the best option. Finally, the best way that humans can make a decision is by being informed, and that is why education is so important. Nelson Mandela once said, "Education is the most powerful weapon which you can use to change the world." In fact, in the top 10 tips to achieve anything you want in your life, number 2 is to seek knowledge. Furthermore, we need patients and families to be open to these conversations. The more education, the less likely someone is to be closed off. In conclusion, now you are aware of the problem within palliative and understand the lack of education is a serious issue to acceptance of a conversation. One day, if you find yourself stuck and wondering if you can find support, I hope you realize that palliative care is a great option and they are able to do so much more than many people realize, and no, I am not talking about death. And now I will leave you with a quote. By supplying expert medical care, specifically treatment of pain and other symptoms, skilled communication, and aligning treatment to patient needs and goals, palliative care teams help patients and families preempt or manage predictable complications, thus avoiding unwanted and often expensive crisis care, according to the CAPC. Okay.
Yay, good job.
Good job.